Hi there, it's Justin Lubino again with Senior Advisors, and I'm here today to talk about some changes that were announced earlier this week from the Center of Medicare and Medicaid Services, or CMS, with regards to Medicare for next year. And it changed the premiums as it relates to Part B of Medicare, the Part B deductible, as well as some changes to Part A of Medicare, which is the hospitalization benefits that Medicare provides. So I just wanted to take a brief moment here and walk through these changes so you understand them and how they may or may not impact you for next year. So first, for the Part B premiums, the majority of people in 2015 are paying $104.90. And this number for the premium for Part B increases as the higher income tiers, or for the higher income tiers. And you can see the incremental prices that certain individuals pay depending on their income. If they're individual, if they're above 85,000 or filing a joint return above 170,000, then they pay the higher Part B premium. Just a few weeks ago, there was projections of over 50% increase on these Part B premiums. And so that would have brought the first tier all the way up to $159 per month. And you could see the subsequent increases as well that were projected. Again, this was just a few weeks ago based on the Congressional Budget Committee. The good news, as of this week, the budget deal that was signed brought the premiums. They were still an increase, but not nearly as high as what was projected just a few weeks back. So that first tier will increase from $104.90 to $121.80. The second tier goes up to $170.50, and you can see the subsequent increases for the other tiers as well. A couple of other notes here. The increase for the first tier will not affect all beneficiaries. There are certain folks that are held harmless from this increase. Essentially, if you were on Medicare in 2015 and you were paying the $104.90 per month, and you are taking Social Security benefits, you're receiving a check from Social Security, then you are held harmless because the COLA, cost of living adjustment, in 2016 is 0% on the Social Security check. So if you're not getting an increase on Social Security, essentially the government cannot increase your Part B premium. And this is what's called the hold harmless provision. If you do not fall into that category, so in other words, if you're signing up for the first time next year on Medicare, or if you're already on Medicare and you weren't taking Social Security, or if you're in one of the higher income tiers, then you're not protected by the increases. So the only ones that are protected are those, again, that were paying the $104.90 a month last year, and they were taking Social Security in 2015. Another change is the Part B deductible. In 2015, this was $147. This is a calendar year deductible. So you pay that, if depending on your Medigap plan, you may have to pay that deductible one time per calendar year. It was projected also to have about a 50% increase. It was supposed to go to $223, but the final actual increase was only about $19 increase. So it went up to $166 in 2016. Now there's certain Medigap plans that cover that Part B deductible. The Plan F, Plan C, or if you have the older plan, Plan J. If you have one of these three plans, you're still covered on your Part B deductible, so you will not be responsible for that increase. However, the expectation is that your supplement premiums cost will go up in the future to offset any sort of increased expense that the insurance carriers are paying for that deductible. For Part A, the changes that were made for 2016. So if you get hospitalized and you're on Medicare, there's a deductible for the first 60 days. In 2015, it was $1,260. That's increasing in 2016 to $1,288. After day 60, for day 61 through 90, there's a copay of $315 a day in 2015. That's increasing to $322 a day. And then if you're in for longer than 90 days, it goes up to $630 a day copay in 2015. That's increasing to $644 a day in 2016. The majority of Medicare supplements actually cover the Part A expense, so this won't directly impact you from an out-of-pocket perspective in most cases, but you want to double check your supplement to make sure that it covers this, or you may be impacted by this increase. The copay as well for skilled nursing facility care. If you get transferred as part of the hospitalization to a skilled nursing facility care, the first 20 days are covered by Medicare, but there's a copay for starting at day 21. It's $157.50 a day in 2015. That slightly increases to $161 per day in 2016. So I just wanted to quickly walk through an actual use case from a customer that was earlier this week. He saw the increased premiums for his Part B, and he was actually going to see an increase overall, over $500 increase in the Part B premiums for next year. So he's looking at a increased expense. It's about $44 a month next year. So we looked at his Medicare supplement plan, and he's got a Plan C, which is good coverage. But for what he was paying for the Plan C, there were some better options that were out there. And specifically, we looked at the Plan G supplement, which is nearly identical coverage. I'll talk about the differences in a minute. But he's going to save almost $900 a year on his premiums with the Plan G. And there's only two differences in coverage with the Plan G versus a Plan C. The first difference is that the Plan C covers the Part B deductible. So he didn't have to pay the first $166 next year for his doctor's visits or outpatient testing, etc. With the Plan G, he will have to pay that $166 for his deductible. So he does have some out-of-pocket exposure, but again, he's saving nearly $900 on premium for that deductible of $166. So it's a great savings for him overall. Even if you factor in the increase in the Part B premiums, he's saving almost $200 for the year, which in itself may not seem like a huge savings, but offsetting that $530 increase on the Part B premiums and still saving money, he was very pleased. We're actually currently going through underwriting, so there shouldn't be any issues there, hopefully, and we'll get him all set up for next year, and he'll save some money, even though he was seeing a big increase originally when we met. For next year. So definitely recommend that you take an opportunity now that these premiums are increasing for Part B to see if there's better options out there for your supplements and see if you could save some money. You can contact us at senioradvisors.com or at either of the two numbers you see below. Hope you have a great day. Thanks.